Right
Yeah,
now, we would
yeah.
welcome Mr. Gaurav to talk about what marketing strategy that we should do. How do we bridge the gap? What the availability of technology, well, the consumer and also doctor, how they would aware of. Can we use what all media? Gaurav, over to you, sir.
Thank you, Mr. Ramdev, for the opportunity and welcome all audiences and participants. Uh, Doctor before me have been the front runners in presenting a lot of technology solutions. Today, uh, I am going to talk about something which is very close to you, which is about your organization and how using the technology which is already available now, how you can actually enhance your business growth. And there is a mix of technology as well as marketing that will enable the adoption of technology from the doctor side as well as adoption of services on the consumer side. So with your permission, I'll introduce my topic, which is post-pandemic digital marketing jabs to grow your healthcare business. I am Gaurav Dhingra, and I represent digital agency Refresh Ideas and Refresh Healthcare. We help businesses to grow their revenue using digital strategy and marketing. As we all know, that pandemic enforced a huge shift in behavior for caregivers and patients. This tectonic shift has presented new landscapes to build institutions of the future because there were already great institutions out from our country and across the globe. Now, to make a move for the new one, this is the right time and the backbone could be digital to deliver those solutions. The opportunity is ripe for healthcare professionals, especially to use this shift and grow their reach beyond the four walls of their practice. So uh, you no longer are basically bound by the geographical boundaries of your reach of your healthcare services. You could operate from anywhere, and complete solutions like telemedicine and virtual clinics can enable your practice and take it forward to geographies unknown to you at present. Let's also review a little bit upon how the consumer, the patients, are using the digital as of now. This is a research paper published by Google, and these are some key highlights from that. 30% of patients search for symptoms or departments, example, sore throat, pediatrics, etc., when they are on the search. 37% patients search for conditions or diseases like arthritis, cancer, and things like that. 19% patients search for branded solution. For example, they have a soft sport or they already know a big brand and they will use that brand to reach that particular facility of their choice. But that's only 19% that leaves everything else above and open. And 6% patients search for specific treatments and procedure to enhance their knowledge. So this is a little bit of a inside story that you should all be aware about. But what is currently happening? Whenever you do these kind of searches as a user, and let me speak as a user first, as a patient first, we end up landing on pages like Wikipedia or international website, mostly from US or UK, sites like Mayo Clinic and things like that. Most of the information presented is English only. 58% of Indian hospital websites that we researched in 2018-19 are actually defunct. For example, they are not even properly opening. The information is stale. So this is the state of when we are serving that kind of a curiosity of users, how they are landing on us. So what's the result? Only a handful of institutions get the benefit of this massive user base, which is being generated not only from India, but also across the world, trying to come to India for medical services. And a large chunk of population is not served, and that creates a vacuum. Now, let's talk about how to digitally grow your healthcare business. We are talking about professionals who want to adapt, professionals who want to build institutions for the future, who wants to use digital as a backbone of their service. The number one thing is to start with a long-term vision, which is patient-centric. It cannot be about your organization or your innovation. Patients or users across the world do not give any importance to that. If I have a problem, I will only be concerned about that problem and the easiest path you can bring me for solving that. So when we talk to various organizations, especially in healthcare, we come back and tell them this is not about you, this is going to be about the patient, how you are making their journey smoother. They can understand your language, not your medical language, but actually the language that they start. As a second step, find a right team with expertise in business strategy and digital technology. It's not only technology that serves, it has to be tied in with the strategy of how you are building it for next 3 5 years. It is not next month or a month after that. Once you understand that, go and find the team. Bring the team internally or externally, but they should sync with your vision perfectly. Redesign a digital experience. Optimize your website for serving digital first patients and providers so that your doctors feel comfortable using the technology first of all, and also when the patient comes in they can see information, they can consume that information, they can interact, and they can actually avail that kind of information properly, book those appointments. So keep the digital first patient experience top in mind when you are redesigning a digital experience. Start on a journey for content creation. Use English and other local languages wherever your target audience is. You know you have to define your target audience, and once you have defined that, use local languages so that people who may not be influenced by English, they can be influenced and can capture the data in their local language. Optimize your pages, your website, your presence with conversion in mind, search engines, and make it mobile friendly. And one of the experiment that we recently did, we checked top websites of the hospitals, and we found that they want to use a lot of blurbs, a pop-up coming over here, a chatbot coming on top of that. When you use these services on a mobile, which is like 70% and above people are using these services from mobile, this create a hindrance for getting the right kind of a knowledge, and they move away from your website and they go back to the old ways of doing dealing with the healthcare practice. And once you have taken care of these major steps, then get onto the social media to increase your awareness, to tell the world how you are helping them, how you are bringing new technology. Talk about the new things like telemedicine. Tell them that you save, how you save coming on a telemedicine bandwagon. Start the virtual clinics, start whatever you want to do. Because if you talk about few months back, prior to COVID, the complete solution was not available. But with the innovations like Tata Communication Glow Heal solution, which can bring you all the solution away for the consumer for easily grasp at a fraction of a cost, and then you can fulfill the whole promise on a digital roadmap for that customer. Not only that, you can have initiate interactions with the customer physically, but later on for a remote patient access for the OPDs, you can call the patients later on. That will brings and enhance your market substantially. So build a digitally powered business, not only a presence, a business that is powered digitally, because then you have the opportunity to scale up to whatever limits. Thank you, guys. That's from my end. Hope this is helpful.
Thank you, Gaurav. I was about to buzz you. Thanks for completing within this time period. And I would like to, it's been our honor, Tata Communication, been honored to have such a great speaker who are not just in a digital market, who also an healthcare experience.